and good evening. So happy to see all of you joining us. We'll start in a few minutes. Wait a few more minutes and we will get started. Michelle, can you change to the next slide, please? Thank you. Right. All right, Whitney, we're going to get started now. All right. Thank you. Well, welcome everyone. It's great to see you all here at our community exchange. My name is Christine Hall, and I'm the Director of Community Engagement for the National COVID-19 Resiliency Network here at Morehouse School of Medicine. I'm so excited to welcome you to today's community exchange. I hope everyone is ready to join us as we take a look at the COVID-19 road traveled. Next slide, please. Today, you'll hear from two of our partners about the successes and challenges of reaching vaccine milestones, including compelling stories, messaging strategies, and social supports. We are also happy to have a nationally recognized mental health expert join us today who will share her knowledge around the mental health impacts of the pandemic. And by way of our website, we will also show you some helpful resources that you can use in your community and for your community. But before we walk down this road, I wanted to go over a few meeting instructions and details for today's event. Next slide, please. This meeting is being recorded and we have a live transcription captioning available. And if you would like to access it, please click the CC button to view subtitles. If you wish to make captions bigger or smaller, please click on the CC button again and select settings. There's a new Zoom feature that includes the ability to move your captions box to your preference, so please feel free to adjust as needed. We also have American Sign Language interpretation team, Ashley Kravolka and Kaborski Ledbetter. So to pin their video, please hover over their screen and click the three small dots at the top right corner to pin their video. You can also click view in the top right corner to adjust your speaker viewing preference. Because of the number of participants, please mute yourself throughout the meeting. I see many of you are doing that already, so that's great. We welcome your participation throughout the event, and we do have a few ways for you to interact during this event. So we want to keep you engaged and involved in this important discussion. So we ask that if you want to speak, please unmute yourself and begin by saying your name. This will help everyone know who is talking, especially our American Sign Language team and our captioner. In addition to stating your name, we also ask that you provide a short image description of yourself, as well as share your pronouns if you feel comfortable. You can chat with presenters and attendees using the chat function at the bottom of your screen. So if you haven't already, please go ahead and introduce yourself in the chat. Next slide, please. You can turn on or off your video by selecting the video function at the bottom of your screen. And if you have any technical issues, please type your tech issues in the chat box by first typing Zoom help, and our Zoom tech guru, Whitney Lockett, will be able to help you. For those questions that you may have regarding the content of this presentation, just type those questions in the chat box as well at any time during the event, and Lisette Badillo will answer those as we go along. As a reminder, this meeting is being recorded and will be available a few days following this event, as well as a written transcript from our captioner. So I just want to thank everyone for coming and welcome you all today. And now please join me in welcoming Dr. Tabia Akintobi.
Thank you so very much, Christine, and welcome all who've taken the time out of their Thursday evening to join this important community exchange. I'm a proud collaborator and partner with NCERN, and am at Morehouse School of Medicine and do all things that really are designed to be a bridge between the community and the academy. It takes all of us to advance health equity, and we know advancing health equity is important now more than ever before. Next slide, please. And so to just kind of frame what the experience that you will have for those who are new to the community exchange, and even for those who might be familiar with NCERN, just wanted to remind us of what NCERN is. It is funded through Morehouse School of Medicine, but it is the only national network designed to coordinate a strategic and structured strategy to address the impact of COVID-19. Not just among racial and ethnic minority groups, but others that are marginalized or disproportionately impacted. And that means increased likelihood of illness, hospitalization, and death related to COVID-19. And so our goal is to provide awareness and culturally appropriate health education information, and you'll learn about some of that, and to create events, resources, and linkages for community and by community. And the community exchange is designed to do just that. Next slide, please. And so here you see some of the major pillars that constitute NCERN. And so it begins with engaging and identifying communities that are disproportionately impacted, but equally, if not more important, are identifying community-based organizations and other agencies that are leading efforts towards recovery. And so not only do we want to identify them, but also to nurture those partnerships and relationships, some of which you might learn and experience this evening. And we want to link communities to resources and technology, which you'll learn more about later. And so the community exchange really was conceptualized as a way to ensure that the broader national and global community was engaged in not just learning what NCERN was doing, but to ensure that you know a few things. One is that you understand the issues. Two is that you know that you are not alone in your challenges, your leadership, or mission to continue in the quest towards COVID recovery. We want to provide resources to you and also bring up important issues that are relevant for us to consider as we navigate this COVID recovery together. So please bring your questions, bring your intentions to collaborate, and know that we are together in this COVID recovery journey. So I'm really pleased to pass the baton to Al Richmond, who is a partner in Good for community engaged leadership and of course in addressing the pandemic. And in our activities, it's important to remind all of us that this work is supported by the U.S. Department of Health and Human Services, and you can see our funding information included there. So Al Richmond, Executive Director of Community Campus Partnerships for Health, I turn it over to you.
Thank you, Dr. Akintobi. It's a pleasure to join you from Research Triangle Park, North Carolina. And Dr. Akintobi acknowledged our partnership and our long-term connection we've had with the Morehouse School of Medicine. It's exciting to be here with you this evening. So I want to say good evening to those of you who are in Eastern Standard Time, and good afternoon to those of you who are in California, and maybe even good morning to those in Hawaii. It's a pleasure to be here and to have you. I want to share with you on our next slide some of the objectives that we have established and that we hope to achieve this evening. And I think that you will, at the end of this, have an evaluation, and we hope that you will determine that we've met these objectives. At the top of the list is certainly to share strategies and resources for effective messages and messengers. And I think that messengers is something that really stood out for me in thinking about not just what is the message, but who's delivering that message. So give attention to that and think about that as it relates to not just the speakers this evening, but also the work that you're doing in your community. To also discuss the effects and resources associated with COVID-19 as it relates to mental and behavioral health in our communities. Certainly, attention has been given to the fact that this is probably the newest frontier around addressing COVID-19, the attention to the myriad of issues that individuals are having as it relates to COVID-19, not just individuals who are living with COVID, but their family members and even our communities that have been impacted by COVID-19. And then finally, to identify opportunities for INSERN to support and share resources for COVID-19 priorities. I put in the chat box at the top of the call a resource that I'm sharing with you, and that is recovercovid.org, which is a new initiative focused on long-haul COVID recovery. I think that's, again, another frontier of work that many people, millions of Americans across the world will be living with COVID. How do we support them and grow that work? And then our outcomes are for participants to receive tools and best practices for communities to use as they continue to navigate through the COVID-19 pandemic, for participants to gain a better understanding of strategies to use and mitigate COVID-19 impact, and then to learn more about INSERN's latest community engagement efforts, and then just to get to know each other. So please take the moment, if you've not done so, to chat your name, your organization in the chat box, so that we can, again, know who's here and know how to reach out to you as well. Thank you, and I'll turn it over to our next speaker.
All right, now Lisette Badillo, our program manager for community engagement, will introduce our first presenter of the evening.
Good evening, everyone. My name is Lisette Badillo. I am a Mexican-American female in my 30s. I have dark shoulder-length hair and am wearing a green button-up shirt. I use she, her, aya pronouns and am honored to introduce our first featured speaker, Mr. Victor Joseph. Mr. Joseph is currently employed with the University of Fairbanks Center for Alaska Native Research and works for the native village of Tanana, of which he is an enrolled tribal member. He served on President Biden's COVID-19 Health Equity Task Force and currently serves as chair on the HHS Secretary Tribal Advisory Committee and co-chairs the IHS Budget Formulation Committee. Mr. Joseph has worked for Alaska Native American Indian tribes and tribal organizations since 1988. In 2014, he was elected chief chairman for the Tanana Chiefs Conference region, a consortium of 42 tribal community members. In 2017, he was re-elected to serve a second three-year term. To the role of NCRN coordinator for Alaska, Mr. Joseph brings extensive experience building strong working relationships with Alaska Native tribal leaders, beneficiaries, colleagues, funding entities, and state and federal officials. Chief Joseph advocates for strong, healthy tribes in advancing Native unity and tribal self-determination for future generations. And we are honored to have him join us today to share successful strategies for vaccination rates in tribal communities and outreach strategies that can be tailored to other organizations and rural communities. And with that, I hand it over to you, Mr. Joseph.
Thank you, Lisette. It's great to be here and just welcome everybody. And also, I guess it's evening where everybody else is at. And so we'll just go ahead and get this presentation started. If I can get the first page and go to the next one, please. And so just a quick introduction of our Canner director, and that's Stacy Rasmus. We already gave an introduction of myself. If we can go to the next. one, I wanted to share with you some brief history about Alaska, and I think it's really important. What you're seeing here is a picture of my grandfather, who was one of the 20 dog mushers that transported diphtheria antitoxins by dog sled to Nome in weather as cold as 60 below. It's also known as the Great Race of Mercy. If you haven't heard of this, please look up this. On the onset of the COVID-19 pandemic, many of our rural communities locked down, not allowing anybody in. If a community member had to leave or they were returning, they were required to quarantine for 2 weeks to 30 days. A lot of this was brought on because of the impacts of the 1918 Spanish flu and the 1925 diphtheria that was introduced by many people visiting our communities, and was usually by outsiders that brought it in, such as people with the mail services. That created devastating impacts. So our tribes were really locking down their communities really hard for their communities. If we can go to the next slide, please. Alaska is a state of unique demographics and geographic characteristics. 1/5 of the population is Alaska Native, representing 229 of the 574 federally recognized tribes, with villages ranging from 12 people to 3,000. The size of the community varies. The state is larger than the combined areas of the next 3 largest states, Texas, California, and Montana. And it's also the least densely populated state within many remote communities. 80% of Alaska Native communities are located off the road systems. And rural residents travel an average of 147 miles one way to access the next level of care, often by a combination of air and land transportation. And land transportation doesn't mean by road. We're talking snow machines, boats, however you might move around. I also want to point out that approximately 30 communities across Alaska and around 3,000 homes are not connected to running water. And there's a severe housing shortage throughout much of rural Alaska. Because of the lack of infrastructure, it's challenging to comply with the most preventative measures that was given to us. Wash your hands, keep your distance, and wear a mask. When you don't have it, it's hard to use. And the community that I'm from, Canada, we're still getting water out of the river. And we filter it, of course, and we treat it, but it's giving you an example of what our tribal communities have to deal with in the middle of this pandemic. Next slide. We're constantly looking at how to improve the vaccination rates that we have. And initially, we started off really well. In the community that I work closely with, over 95% of the adults were vaccinated. However, throughout the time, and as we moved into the booster recommendations, and as the other age groups were being authorized, what we're seeing is a decrease in the population's willingness to become vaccinated. And so we're really working on a campaign strategy to help influence the children 5 and up, and especially the younger adults, to get that booster shots that were just authorized. So, and if we can go to the next slide. COVID testing, and we have a lot of challenges and successes here, but some of the problems that we're still having, can we get enough of the reagent? And so just a certain type of the reagents that we're having challenges with, we're only allotted 30 of those samples that we can have in our community at any given time. We're relying a lot more on the antigen test, and so that's been helping keep the group. And we want to test everybody that's coming out into our communities, and that way we can capture, hopefully keep it out of the communities while we're seeing a spike in what's already in the communities as this new wave has been upon us. I was given some numbers just recently, and I guess Alaska is now per capita one of the top states with new infection rates. And so that is kind of, so it's really important for us to know what we're doing, how we're going to do it, and how we're going to be responding to it. And another factor here is with testing comes a responsibility. And what are you going to do with the individual if they do test positive? And how are you going to help their homes, knowing that the families, knowing that many of the homes don't have the adequate spacing for people to keep isolated from one another. So you're basically, when you have a positive in that family, that whole family is being quarantined. And so that makes it really challenging to address. And so you have responsibilities to help them as a community member, bringing them food, making sure that they have water, just those basic needs people are going to need. And how do we bring that to them safely? In addition to that, if we are catching them before they go into the community, such as catching them in the regional hub, we have to be prepared to purchase lodging for them and meals. And so there's a lot to this testing when we start doing it, and it creates a lot of extra responsibility on tribal leadership. To the next page, please. This is just a small example of how complicated the partnerships are. And this is kind of the high level view going down. This doesn't include the partnerships that we're having to work with airlines, hotels, schools, city governments. This is just how do we get to our basic funding and the supplies we need into responding to the pandemic. And it's what this slide is trying to do is just describe how complicated tribal health services can be, but it also works when it works. An example of it working really well is when the state of Alaska medical director, Dr. Zink, started working with the tribal health organizations to get our communities vaccinated. We had a really good initial response on that. Many of the communities' first vaccination happened at a real high rate. The second was a fairly good, the second shot was a fairly good rate. As I indicated, it's the boosters and the kids that we're now being challenged with. However, what the tribe, because of the coordination and the communication, and because of the tribal health system's ability to respond so well to the vaccination, and then they had excess medication, they started opening it up in a lot of our larger communities in Alaska, such as Anchorage and Fairbanks, to non-tribal members. And that is a really unique situation for services to be provided outside of tribal health to non-tribal health members. And so that was real beneficial. Next slide, please. You know, a lot of communication and messaging is really important, but communication and messaging is really challenging, especially when you look at what do you have and what can you do. In Tanana, where my tribe is from, one of the things they're trying to do to improve communication is, are you ready for this? Connect every home to two-way radios, back to CBs, okay? And so if you think about that, then you got to understand and ask yourself, why do you have to do this? And why you have to do this is because many homes cannot afford the cost of the devices and or the internet services that go out. An example of cost would be this. For a data usage plan of 100 gigabytes would cost a home approximately $315. And so I don't know what you all are paying for your internet services at home, but I don't pay that in Fairbanks. And if you think about that, 100 gigabytes of data usage isn't very much. It only takes a few of these type of meetings and it's gone. And so what happens is many of the communities are running out of that before they even, or many of the families that are lucky enough to afford it run out of it, and then they're having to pay $10 for an additional gigabyte, or $7.50 for each additional gigabyte, or $75 for 10 extra gigabytes. And so that's just a heavy burden and a heavy cost on people. So to try to maximize telehealth services, which many of our providers are trying to do now, is really challenging. And so the only way that they can, and hopefully they haven't tested positive, they can go down to either the clinic, maybe the school, or our tribal health office to have a telehealth session with either their behavioral health provider or their primary care provider in delivering those services. So communication and messaging can be really challenging. And we're trying to figure out unique ways in Canada how to help people communicate and to get that common messaging out that's needed when we need to share information. We still develop just little posters that we take down to the local store and hang in different places. And that's the way we generally communicate with one another right now. And that's not the most effective way. So there's a lot to do in some of our communities there. Other communities have better Wi-Fi access or internet access than some of the smaller communities. I'm just sharing with you what I know of a few of the small communities and the challenges they have in communication and messaging. There is a lot of information out there that's coming into the communities. And I'm really thankful for the Alaska Native Health Board and the National Indian Health Board and helping communicate all the communications. I'm really looking at how with the partnership with INCERN, we can be looking at our messaging that kind of expands into other communities, and how do we do that and share that with our partnerships. So I think I covered the about amount of time I have. The next slide, it just goes into questions if there's any. And Christine, I just wanted to really give you a holler there and shout out to you for really helping me out in this process, okay?
My pleasure, Victor. Are there any questions? I think one or two may have come in through the chat. Do we have anyone who wants to follow up with any questions from Victor or for Victor?
Victor, this is Al Richmond with CCPH. I wonder what are you most hopeful for that could come out of this really dire situation? Seems like the community has been extremely responsive. You've taken the lessons from the past. What are you most hopeful for?
Well, I guess one of the things that we're all hopeful for is that we really look at the disparities of people of color and really get to be able to address that accordingly and knock down any of those barriers that are unnecessary that keeps us from good quality healthcare. And whether tribal, non-tribal, there shouldn't be those type of health disparities that we have to deal with on it every day. And I'm not surprised the impact that this pandemic has had on people of color based on the health disparities that we deal with on a regular daily basis. So that and infrastructure, people ought to be able to wash their hands when they need to wash their hands. And they should be able to have affordable, usable internet services. So those are some of the things that I'm hoping for. Alan, I believe it is.
Yes, thank you.
Victor, a question for you is, how did you handle any misinformation, disinformation in the community around the vaccine?
Well, I think our whole nation, as you know, our whole nation is dealing with a lot of misinformation. And one of the challenges that we're having with right now regarding misinformation is that the current wave of Omicron is not as bad as other ones, and so other variants. And so, although that's true, it's also wrong because people are still dying.
Mm.
And so when you're looking at that, how do you manage that? Because I have people coming back in the community now not wanting to wear masks, saying, well, this wave ain't as bad as the other, and how we're going to address it. And the only thing that you can do is get out the proper information. And one of the things that I'm constantly doing now is telling people, you know, okay, in the last 2 days, Alaska had over 5,000 new infections, you know, and so that's fairly significant. And the last time I looked over a few day period, during that period, we had 64 deaths. And Alaska Native people are still have a lot of the health disparities that make them greater at risk. And so no matter how different this variant may be, it's still bad. And so it's just trying to correct that information from the get. And when you hear it, you have to say something, because if you don't, then that is just going to continue to blossom.
This is Lisette speaking. And Victor, I have another question for you.
Go ahead.
How, if at all, does the lack of microdata on Alaska Native communities by gender, age, location, etc., affect your ability to respond to crisis, get funding, and engage in public and community health efforts? Data drives so many decisions and the communities are othered.
Well, getting the data you need initially, I think, was for tribal communities, and I did a lot of research on this, and so a little bit of information on that part. For me, if you're not having the information that's necessary in order for you to respond to it, then of course you're not going to respond accordingly. And if the people that are responsible for getting you that information don't have access to it, then they're not able to do their jobs. An example would be is, you know, a lot of the tribes throughout our nation has epidemiology centers for each of the areas. In Alaska, we have ours, but they need to have that real time access to that information to be able to guide the tribes in their response to the pandemic. And if they don't have that information, then we're not responding to real-time data.
Okay. All right, thank you so much, Victor. I think we have just one more. We have time for one more, and then we have to continue down our road that we're traveling together. So we are going to ask this next question. Besides the misinformation, how do you deal with fake news when the fake news is coming from a well-known institution that are supposed to be credible? How do you handle that? Great question. And it's probably hard to answer.
Well, right when that question's asked, I go to, you know, the political side of me and think, you know, I probably shouldn't go there, but I'm going to. It was asked. It was
probably
asked.
Not. Probably should
No,
not.
I'll leave it on. It's just that there's a lot of bad information out there, and you know, really, you got to focus on the scientific information that's being handed out. So we'll go there. So
Great answer.
I'll leave it at that. Okay, Christine, I got my cue from you.
Great answer. Well, thank you so much, Victor, for your presentation. I know there's going to be other opportunities as we have our national meetings that are coming up, not only next month, but also in the following month that I'm sure people are going to, community partners are going to be a part of, and there will be other opportunities to even follow up more on what you've shared. But thank you so much. And at this time, I'm going to pass the Zoom microphone to our NCCB chair, our National Community Coalition Board Chair, LaShawn Hoffman, and he is going to introduce our next speaker.
So greetings, everyone. As Christine shared, I'm LaShawn Hoffman. I work at the intersection of community development and public health, and it is my privilege to be with you guys today as I serve as chair of the National Community Coalition Board for the NSER Network. And I'm going to introduce our next speaker. Keisha Holden is a counseling psychologist, is the Poussant Satcher Endowed Chair in Mental Health and Associate Director of the Satcher Health Leadership Institute at Morehouse School of Medicine. Also at Morehouse School of Medicine, Dr. Holden is Professor and Director of Research and Scholarship for the Department of Psychiatry and Behavioral Sciences and Professor in the Department of Community Health and Preventive Medicine. Dr. Holden has dedicated her career to encouraging mental health and well-being among ethnically and culturally diverse families through research, programmatic initiatives, and the development of innovative strategies for informing health policies. She has placed a special emphasis on addressing the needs of underserved and underrepresented populations that are often overlooked yet prevail in contributing to the myriad of health disparities. She aims to, 1, promote excellence in community-based clinical and translational mental health research, 2, to develop innovative programs that improve accessibility of individuals to comprehensive health care, and 3, develop culturally centered, gender-specific, resilience-based prevention and intervention models for individuals at risk for depression. She's an advocate for the Lupus Foundation of America, the Atlanta Ballet, and Delta Sigma Theta Incorporated, a public service sorority. She enjoys gourmet vegan cooking with her stepdaughter, Michelle, and her husband, Dr. Elton Holden. Please join me in welcoming my friend, Dr. Keisha Holden.
Thank you so much, LaShawn. That was such a kind introduction. I am delighted to be here this evening to share with everyone information that I believe is very relevant. I'm passionate about mental and behavioral health issues. And for all of those nice things that LaShawn said about me, all of that equals I'm a psychologist at Morehouse School of Medicine. And next slide, please. And so today, I'm going to just talk about some of the ways we can cope with COVID-19 stressors that we have all experienced. I was particularly pleased. Well, it was bittersweet. Excellent presentation, Victor. But at the same time, it made me think about how we're trying to cope with, just manage a lot of the different stressors that we're all experiencing in different ways. Next slide. So I will first just start out by giving you a definition of mental health. It's really a combination of how we are managing or trying to have some level of mental functioning. And it's really about how we are productive in different activities that we engage in, how we have fulfilling relationships, how we deal with stressors or situations, the adversities that may happen. And this occurs over our lifetime. So from early childhood to later in life, we have different ways in which you're trying to integrate different ways that we learn, different ways that we are dealing with emotional situations, our growth when it comes to resilience and self-esteem. So all of these things in combination must be attended to or help us to understand what it means to be mentally healthy and that we're always striving to be mentally healthy. Next slide. So there are a number of different disparities and they're listed here on this slide, but I can just tell you that when it comes to mental health, behavioral health issues, and when I say behavioral health, I'm talking about drug use, abuse, or dependency, or behaviors that a person may engage in that may be not so healthy, drugs, alcohol use. But when it comes to racial ethnic minority populations, we experience a greater burden of disability and trying to cope with different mental health issues in a different kind of way. And that was captured in a report that Dr. Satcher, David Satcher, he was the first during his time as Surgeon General, and he was the first one leader to put on the map mental health for us to even discuss it. It's still a great deal of stigma when it comes to mental health issues or disparities that exist, but this report that he released during his time as Surgeon General was entitled Mental Health, Culture, Race, and Ethnicity. And it really broke down some of the issues that are important to ethnic minority groups, particularly concerning access to care or mental health care, that we receive less treatment when it comes to mental health treatment. And in some ways, we also receive poor quality of care. So part of what INSERN is trying to do is address the ways in which we can deal with mental health, behavioral health issues that may be presenting from more of a culturally centered perspective. So we can more or less meet a person, individual, a family, a community where they are, and then help them to be in a more positive space. Health equity is about giving people what they need when they need it and in the amount that they need it, so that they're able to achieve the optimal levels of health. And so that's essentially what we're aiming to do. And we realize too that addressing policy issues is such an important part of that as well. So really a combination of mental health providers, scientists, researchers, public health professionals, policymakers, working in combination, which is why I'm really happy that we have this discussion today, such that we are looking at how to strengthen and build different partners, collaborations that we have within INSERN, the National COVID-19 Resilience Network. Next slide. And so when it comes to the COVID-19 pandemic, it's really, some people believe that it may be ending, but we're still kind of in it strongly. One of the things that's pretty much traumatic and has been for the last several years is that anyone can catch it. You can't really see it. I can't tell you the number of stories of people who have said to me, I have COVID-19, but I'm not sure how I got it. I was wearing my mask. I was implementing the mitigation strategies that I thought were going to help me to not get it. So I just want to encourage us to be as positive and diligent in implementing these mitigation strategies as much as we can. But it has had a traumatic impact on people. Even though we do have vaccines now, there's still a great deal that needs to be learned about COVID-19. And that is something that continues to be an impact that we're trying to learn as much as we can as several different variants continue to come out. However, another traumatic aspect, though, that I can capture or at least identify is centered around just how we live, work, and play. And that has changed dramatically. And there are a number of different ways in which we're trying to cope or shift or modify what used to be our normal, but now we have a new normal that we're all trying to deal with. And so this is particularly problematic or challenging for some, particularly if they're being isolated or in isolation or quarantining. But there are a number of different mental health issues that we know are apparently impacting just our overall lifestyle. whether it be within school, within work, within different communities that we work with. But I can identify that there's been an increase of domestic violence cases, or at least reported domestic violence incidents. There's been an increase in child abuse and neglect cases that have been reported. And unfortunately, we know that from a myriad of different research that's been conducted, that even though their reports or information is shared, a lot of times that's a lower amount than what is actually in existence. So we have to just keep that in mind, in context, so that we understand that. There's this enduring aspect of the COVID-19 pandemic that has impacted people as well. For some, not seeing the end any kind of end in sight, and that social connection or lack thereof, the social connection can help increase their risk for any number of different mental and behavioral health problems. It's this bi-directional relationship that exists, because on the one hand, people may say, okay, I'm gonna cope better by having a drink or doing some other kinds of things that may not, or overeating. I know I gained a few pounds during the pandemic. Whereas the other side of things may be, okay, I'm by myself, I'm isolated, I'm not necessarily doing the most healthy kinds of behaviors that would be helpful to me. Next slide, please. And so when it comes to, again, I'm not gonna belabor the point, but domestic violence has gone up, or the reports have gone up. Suicide prevention hotlines have been inundated, as well as child abuse, neglect. But this is all centered around a sense of hopelessness, isolation, loneliness, helplessness, and loss that has been experienced by people, whether it be through social distancing, sheltering in place, closures when it comes to businesses, when it comes to schools, being unemployed, underemployed, and so on. So all of these things collectively increase a person to worry, have additional stress or stressors. And so all of these things can work in combination to increase risk for depression, anxiety, post-traumatic stress disorder, and other kinds of mental health problems. Next slide. So when it comes to the role of these different stressors here, and I'll make sure that Christine, if you can send the slides out to everyone later, just so they have this information, that, you know, when we think about, I just don't want to separate mental health from overall health and wellness. And so there's really this connection or interdependence between mental health and overall health. And so a person may have any number of mental health problems that can increase their risk for cardiovascular disease, for diabetes, and so on. And conversely, someone who may have a physical health problem that may increase their risk for mental health problems, such as COVID-19. And so being mindful about ways in which we can look at some of the stressors, whether it be the health issues, whether it be what's happening in our environment, the different isms, sexism, racism, classism, all of the isms, quite frankly, can be stressors that impede us, and even more so when it comes to COVID-19. You know, it's interesting because at Morehouse School of Medicine, we've been doing a lot of health disparities, mental health disparities work for a long time, but for the first time, or this may be somewhat of a new issue for the world to see and understand that these are real, the disparities are real. So I'm kind of glad that the pandemic has allowed people to get a sense of, okay, disparities do exist and there are very real realities, particularly for ethnic minority, marginalized, vulnerable communities. But we have to be able to look at ways that we can kind of manage the stress that is in our control. And there are a number of different ways that we can do that. Next slide. Next slide. Okay. I do want to touch on that the Surgeon General, U.S. Surgeon General, he developed the Youth Advisory Council on the impact of the COVID-19 pandemic. And so Dr. Murthy, he has issued a number of different approaches that can be used to help with youth who are particularly issues that juveniles may deal with or are dealing with, particularly when it comes to school, when it comes to social engagement, and most social and emotional growth and development. All these things are important. Interacting with peers and being able to access health services, all of these things, if you think about it as adults, we're already experiencing certain kinds of stress or stressors, and young people have their own interpretation of situations, and they are dealing with those issues as well. So youth involved with different kinds of issues, and they may try to cope with different mental health problems in ways that may not be as healthy. And so we have to be on the lookout for what those triggers could be or may be for them. Next.
I think
So here's
just in, Dr. Holden, just in the interest of time for our next, the rest of the road that we're traveling, if we could, jump to.
You can go to the next slide.
Yeah,
I just want to, it's fine.
Okay.
Yeah, the next slide has different recommendations or different, well, I guess it doesn't. This is about managing stress and dealing with prevention and self-care. But again, Christine will make sure you have these slides. I won't go through all of this, but managing stress is such an important piece. Major bullets would be around looking at it specifically for yourself, for your family, and how you can develop action-oriented plans, look at ways you can build up resistance to stress or your vulnerability to stress, and your reaction, reducing the reaction to stress that you may have. And also a number of different self-care is critically important. Okay, the last slide, next slide, just has a number of different resources. Next slide, please.
Mm-hmm.
Chris, you can go to the next slide.
Yes, there it is. And we are going to drop some of these websites into the chat so that you all have them.
Okay.
Yeah, go ahead.
And this is where I wanted to end. So here's just some resources that you can use, that you can access about coping with or dealing with the COVID-19 pandemic from a mental health perspective. The American Psychological Association, the National Alliance of Mental Illness, as they have these different resources. Okay, thank you.
All right. Thank you so much, Dr. Holden, for just framing the important discussion that surrounds the mental health impacts that not only we all as adults are feeling, but also the impacts that our children and youth are experiencing as well. It's just really important to make sure that we are, acknowledging that that is the stressors that have come on, and also the way that it is especially impacting our children and our youth. We're going to, move on now to our next speaker, Rochelle Hurd, who is our program coordinator for the community engagement core here at Morehouse. She is going to introduce one of our Regional Community Coalition microgrant awardees.
Thanks.
All
Thanks,
right.
Christine. Good afternoon, everyone. My name is Rochelle Hurd. I am the program coordinator for the National COVID-19 Resiliency Network here at Morehouse School of Medicine. I have the pleasure of introducing our next speaker, Mrs. Lane Peace Hendricks from Kate's Club, a children's bereavement organization in Atlanta, Georgia, that is also one of INSERN's Regional Community Coalition microgrant awardees. Mrs. Lane Peace Hendricks, who holds a Bachelor's of Art in Philosophy from Georgia State University and a Master's of Science in Clinical Mental Health Counseling from Mercer University, is the Director of Programs and Partnerships at Kate's Club, where she leads their outreach program called KC Connects and oversees the quality of all programs offered to Kate's Club's members and their families. Additionally, she trains professionals in Georgia and nationally on working with grieving children, young adults, and families. She is a National Training Associate with the Boys and Girls Club of America, serves on the editorial board for the American Cancer Society, and on the Education Committee of the National Alliance for Children's Grief. She is the co-author of We Come Together as One, Helping Families Grieve, Share, and Heal the Kate's Club Way. Personally, she has raised 2 grieving children who are now young adults. She currently lives in Tucker, Georgia with her husband. We are excited to have her speak with us about mental health and share ways to help the youth cope with COVID-19 related issues. Without further ado, Mrs. Lane Peace Hendricks.
First slide, please. Thank you so much, Rochelle, for that kind introduction. And I just want to thank INSERN and Morehouse and all of you really for supporting us. And I want to talk a little about mental health in youth, and especially a slant toward grief, because that's what Kate's Club does. So I want to tell you how we're going to be using our grant and how we're already using our grant and what we see the need to be and why we applied for the grant, and kind of how you can maybe take some of our knowledge and put it into your communities as well. Could I have my first slide? Thank you. Or go to the second one now. Next slide is fine. The next one after this one. Wait for you, say what's happening? Can we go to the second slide where yes, thank you. Kate's Club, our mission is we empower children and teens after the death of a parent, sibling, or caregiver. We really do this by building healing communities. We do direct service at our clubhouse in Atlanta, Georgia, and we serve all the metro counties, surrounding counties, where we bring in children to do group activities, social, recreational, and therapeutic, and provide services for their family. We also, which I'll talk more about later, have our Kate's Club Connects, which reaches out into the community. And our vision is this world okay to grieve. So I'm going to ask you to do a poll. I was told to make this interactive, and I love interaction, so please feel free. I believe Whitney is going to put our poll in the chat. And I want to know how you're feeling today. So it's our poll should come up. It's not going to display in here, but it will display in the chat. If Whitney can put that up and we can connect it with our phones, or yes, right there. You can use the QR code. 485995 is the text, or at the code for slido.com. And Lisette is putting it in the chat. So I would like to know, how are you feeling these days? Flourishing, floundering, or kind of holding steady? So we're going back and getting some good responses. Okay. Take another few seconds. Well, there we go. And I'm not really surprised. Most people seem to be holding steady. This is so fun to watch. But we know that some of us are floundering. So I want you to keep that in mind as this prolonged pandemic has gone on, and think about also the impact that must be having on our youth. As we're adults, we have some, we hope, resilience that we've learned and how we've learned to cope through the years. But our youth, many do not have that expertise. So I want you to keep that in mind. And thank you for being honest, because some of us are floundering right now. I heard the word languishing used to describe how we are at this point in the pandemic. And many of you parents, my children are grown now, but my heart goes out to you too. Those might be the ones that are floundering more, because it's just so hard. Okay, if we can go back to my other slides. Thank you, Lisette. This is great. And I want to tell you about the declaration. Many of you probably saw it from the American Academy of Pediatrics, American Academy of Child and Adolescent Psychiatry, and Children's Hospital Association, saying that this pandemic has worsened the crisis in child and adolescent mental health. So we were already on the road to a crisis. The pandemic has just accelerated it, I believe. Suicide rate had already rose steadily between 2010 to 2020. And by 2018, it was the second leading cause of youth 10 to 24 years of age. We have seen children come in bereaved of a sibling where the sibling was as young as 11 years old. To keep that in mind, I've seen them getting suicide getting younger and younger. So if you can think about how the everyday struggles before with children's mental health, and how Dr. Holden talked so eloquently about the lack of access in especially communities to mental health care and parity, that you just see that even worse in the last 2 years. Okay, next slide. So I have another poll for you. What are some words that you think of when you think of what young people are facing today? So we can have that poll put up. I don't know what it takes Lisette a moment. Oh, Leslie, my heart goes out to you.
Thank you.
So if you have your Slido up, you can just put in words. If you put it in, powerful. And then I will see some of the words are coming through in the chat. Soul crushing is what I've heard from children. Hard, overwhelmed, uncertainty, isolation, loss. Divorce, tragic, isolation. So the word that's coming up most is isolation, but all those around it: confused, stunted, hard, lonely, despair, tragic, floundering, our word from before, and uncertainty. So I think that's a really good capture there. Lost and isolation are the two words that come up most. Okay, if we can go back to the regular slides. I just confused, hard, lost, isolation. I would like to take a snapshot of that if someone could, because I think that really says a lot about what we're going through. at what children are going through, children and teenagers. So a lot of the same words I will be using: grief, isolation, helplessness, worry, uncertainty, those change plans for the future. The grief has been overwhelming in this pandemic. So I'm going to talk a little more about grief from bereavement, which is deprivation by death, is what Kate's Club works on. But to keep in mind, there has been grief in our children from all causes, from separation from their friends, from separation from their family, their normal support system. Many people access care of all kinds in school. And there's been grief from missing graduations and birthdays and other celebrations. So it's really important to know that grief has been really overwhelming, mainly due to the isolations. So you see children who have been isolated from their normal support systems, and maybe they're in isolating at home is an more unhealthy environment than they might be out in school or in work for teenagers and other places, in their events and their activities. They have a lot of worry. What will happen if something happens to one of my parents or my caregiver or my friends or myself? What the uncertainty, children thrive on routines. They may buck against them sometimes, they really thrive on routines, and even teenagers. So this uncertainty of every day of whether they'll go to school or not, or whether they have to stay home and try to learn while maybe mom or dad is trying to juggle work and their school. And also keeping in mind that I'm speaking from a place of privilege where I could work from home, and many people cannot work from home. And there's the childcare crisis has thrown that into the play of, if you have to go to work and your child is home from schooling, the stresses of that on the family, and then the mental health, how that affects a child's mental health. And the change plans for the future. Many teenagers delayed college or other plans. And also this uncertainty of their economic future or their economic stability with their family. Next slide. I definitely want to emphasize, like I said, I'd be emphasizing grief because that's what our grant is specifically being used for. So I want to talk about bereavement in children. This is more now. This was from last year, so this number has grown, but they estimated 100,000 children bereaved by COVID. So this is from the death of a parent or a caregiver. So many grandparents that were raising grandchildren or co-raising grandchildren. Sometimes we don't count that number in our big 1 in 14 children in the United States will experience the death of a parent or a sibling before age 18. But those are pre-COVID numbers as well. And also we don't take an account in that number the number of grandparents that have been raising grandchildren that were especially vulnerable, that have been especially been vulnerable to COVID. So non-white children lost caregiving adults at much higher rates than white peers, you can see. American Indian, Alaskan Native, and Native Hawaiians and Pacific Islander children lost caregivers at rates nearly 4 times the rate of white children. Black and Hispanic children near 2.5 times the rate of white children, and Asian children at 1.6 times the rate of white children. So you see, this is not we can't just, use a brush to paint every community and child the same. This is disproportionately impacting children that are already vulnerable in some cases. And as Dr. Holden spoke, with lack of access to mental health care and support as well, and health care, which is why we see the rates being so disproportionate. Next slide. We know the risk of unaddressed grief. Grief causes distress that can lead to depression, anxiety, guilt, coping, avoidance, and isolation, which in turn can lead to that academic decline, aggressive behavior, and substance abuse. So if we think about children bereaved, especially from COVID, the guilt and the isolation has been even more. We see children coming into Kate's Club who feel guilty because maybe they brought COVID home to the family. The lack of rituals and funerals during this pandemic, while we've had to isolate, it's been especially troubling for children and their families. You know, we're really important. Funerals and memorials have been around a long time for a reason, because they help us start our healing. I never say closure because there's no closure, but there is healing and there is moving forward in grief. And funerals and that community support is usually the start of that. So we have been deprived families of that, especially during the first part of the pandemic when they could not gather safely. There's blame in families that have been torn apart by COVID deaths because of the nature of COVID, frankly. And then there's some stigma behind it too that children feel after a COVID death. But we've been helping grieving children since 2003. So we think we're in a great place to continue to do that. I know somebody asked in the chat, was that in Georgia? And that 167,000 is in the US. We know 1 in 13 children in Georgia before the pandemic were bereaved from a parent or sibling, 1 in 14 in the US. Oh, that's a great point. Children of long haulers are also suffering due to caregivers' chronic illnesses. Yes. Many times what I've seen with the COVID-related deaths is that the whole family had COVID, and maybe that parent or that grandparent then went to the hospital and the child never saw them again. So we have to consider the trauma, the impact that COVID has had as a traumatic death, frankly. Next slide. So what we're doing with our grant that we're so thankful to have is that we're put it into our Kate's Club Connects, because Kate's Club Connects goes into our communities to serve our children. So we go into we go into schools to do groups, because when a crisis occurs, schools are really viewed by children and families as a place to turn and help and support as many children and families as they can. And children spend so much time in school. So schools are really able to get to know children in a way and to monitor their progress over time. When grief happens to a child, it is not one and done. It is a long trajectory. And staff is seen as knowledgeable about how to help youth development and behavior and emotional well-being. Next slide. So with our grant, we're going toward Kate's Club Connects. And let me tell you what we do with that Kate's Club Connects. We bring grief support directly into the schools. So we can do 6 weeks grief support with students ages from K through 12. We are set to have about 25 in Metro Atlanta this semester. We probably have more. And what this grant is also helping us to do is reach outside of Atlanta to train other professionals to go into schools in more rural areas, which are really excited about reaching outside of Atlanta, where in some counties in Georgia, the rate of bereavement is as high as 1 in 10 children. We want to go into areas like Macon and Albany, Georgia, which have been hit very hard by the pandemic. We're also offer grief education to children so that they know that grief is a normal life event. It's a natural reaction to loss, but how can we support ourselves and others when they're going through grief and when we're going through grief? We are training school staff and youth development professionals. Very important. We know we can't reach every single child in our state or in our region, but we know we can train as many professionals as possible to work with grieving children, to recognize grief reactions in children, and to recognize some of those other mental health issues in children. And we can educate parents and caregivers, which we do. And one thing from the pandemic is we've reached even more professionals and parents being able to use a virtual platform. And then we go into a school after a crisis, and we're able to do follow-up care with the students and the staff after there's a death in a school. So this is what this, INSERN's grant means to us. And so just wanted to give you an overview. That picture is of a mask. So we do a mask activity, and that's the inside of a girl's mask, who you can tell what she's keeping inside her, where she's showing, should have had the other side too, where she's showing a happy face and she's showing laughter and she's showing things that nothing bothers her, she's okay. But on the inside of the mask, you can see those more emotions that we don't always share. Next slide. And one more poll. This is the last. Well, it's a word cloud again, which I love. So I want to know, what are some strengths you see in youth, Okay. And I do want to take time for questions, and I think we're almost at the end anyway. But if we can maybe get that poll up as soon as possible. I'll go on and talk while you're filling in those words of some strengths, because we know children can be resilient, and that's what we really want to do at Kate's Club, is help children be resilient. Children aren't resilient without help, though. They're no more resilient than adults. They're actually less resilient than adults because they haven't faced adversity before. And resiliency is kind of like a muscle. You have to face adversity in order to become more resilient. So when we say children are resilient, that's really not true. Can children be resilient? Yes, they can, because we can help them become resilient. And so I really hope in your communities you can take some of the knowledge that we are imparting here, and with Dr. Holden's talk as well, that we can help our children to be more resilient. So you see all those traits that we know youth have. I like to play. That's why we play at Kate's Club. Everything is activity-based. We don't sit around in a circle and talk about our feelings. We're always doing something fun or something creative. Perseverance and understanding. Thank you. Strong and flexible. Children are strong and flexible. We always need to help. Okay, next. Let's go to the next slide. Perseverance. I love this. So what you can do to help youth be more resilient is look for group peer support. Start those groups in your school. Family support. Children do not live in isolation. They live in a family unit. So we have to strengthen that family, both socially, spiritually, mentally, but also by helping them have their cultural beliefs, like somebody put in there, and looking at their strengths as a family. But they also need economic stability. It's really hard for children to be resilient when they do not have stability. So we have to strengthen our families in all kinds of ways. We can help children through social emotional learning in school, including grief education. And we know that supportive teachers and leaders help. So that's what I, challenge you to try in your communities, is connect families with resources as much as possible, possibly even virtual support, if possible. But as was said before, not every community has that virtual option. So that even goes into the greater need of accessibility, because mental health professionals are not in every community. But if you can connect your children you're working with to local bereavement organizations and mental health agencies, keep a robust referral list, not just for mental health, but for those things like food, clothing, housing stability. All those things help our children become more resilient during the pandemic and afterwards. Okay. Good to see if anyone has any questions. And everybody can take a look at the word cloud, I will, after this too.
I have a question.
Yes.
First, thank you so much for this amazing work and all that you're doing to promote children who are resilient. I love what you shared about how we can help them to exercise resilience. So how as an organization, if any, do you build in ways to ensure that you all are prepared for the load that you carry in being strong for children and to promote their strength? Dr. Holden shared that there's no health without mental and behavioral health. And certainly to help to facilitate resilience, we as leaders and those that care for others also have to be strong. So is there any tips you might give to those of us who are leading and doing work like yours to ensure that we are also flexing those muscles to be strong because we're serving?
So important, so important to any of you doing this work. All our first responders, all our mental health professionals, so important. I'm grateful that I work for such a great organization. We're small but mighty that know the value of mental health for the people on staff. So it's heavy work. It is heavy work. So what I advise people to do and what we do is we get together to debrief as peers. We make sure we take our time off if we can. It's not always easy. And I think, for mental health professionals, especially, it's really important to put boundaries. You feel guilty sometimes. We wouldn't be in this profession unless we wanted to help everybody, but you cannot help others, like you said, if you're depleted. So setting boundaries, I try to tell people to stay away from your email, your phone, I don't watch the news. Things as simple as that to try to keep as healthy as possible by filling yourself up. And sometimes that's to practice, some of my coworkers do yoga. I like to walk and hike. I do improv. Anything that takes you out of your mind, that keeps you very present in a space, I think is very important. But also by, sitting, saying, I can't do this work if I'm empty, so I have to take care of myself. And that's so important right now for our teachers, for our school counselors and our counselors in the community, that they make sure that they're able to try to take care of themselves. Thank you. Great question.
Yeah, and I just have something really quick as well, as whether we're, parents, grandparents, or aunties, uncles, how do we navigate this digital world we live in, knowing how much it can impact our kids and youth mental health?
I think we have to be a little old school in that we have to limit it, whether they think you're a terrible parent or not, that you have to have limits on it and what they can see, and having open conversations, just like we do about grief. You have open conversations with your children about why this might be harmful. How do you feel after you've been on TikTok for an hour and a half? Do you feel better? How do you feel versus, going out to play soccer? Does that TikTok make you feel better, or does the Instagram, especially in having those open conversations? Are you comparing yourself to other children? What I was telling someone the other day, I see a lot of video game addiction in boys more so than girls, and phone addiction in girls. And I'm talking straight addiction. And I see children after the death of a family member. So I see those increase a lot of times. Is there, how adults may numb with a substance? A lot of times children numb and isolate with those devices.
Thank you. That is excellent. Such great information and insights from both you and Dr. Holden. So thank you so much, Lane.
You're welcome. Thank you so much.
Okay, well, we are going to shift gears as we head to the last portion of our road. You like how I said that there? That was but thank you so much for staying with us. We really want to make sure that we have an opportunity to share with you some of our website and NSERN platform enhancements. So please, if you can, stay with us just a little bit longer. Stay on the road with us. You know, continue to enjoy the ride. I think that's probably enough, but you get my what I'm trying to say. But now we're going to have Brittany Bethia, our Director of Communications and Dissemination, introduce our next speaker.
Thank you, Christine. As she said, my name is Brittany Bethia. I'm the Director of Communications and Dissemination for the National COVID-19 Resiliency Network. I'm an African-American woman with Black hair, and I'm wearing a yellow sweater for those individuals interested in a visual description. I have the pleasure of introducing Ms. Kate Iannelli. And Kate Iannelli is a digital product director for KPMG's Lighthouse, which is KPMG's digital consulting practice. Kate works with healthcare and life sciences clients to design meaningful digital experiences. Kate has worked with the Women's Tennis Association to create its health and safety platform, as well as the University of Colorado Boulder to create its Buff Pass. Prior to joining KPMG, Kate was a design strategist at Medtronic, where she helped design intuitive support services for tachycardia patients, which are people with a heart rate over 100 beats per minute. She holds a BS in finance from the University of Delaware and an MA in design from the Maryland Institute College of Art, as well as an MBA with healthcare concentration from the Johns Hopkins University. She and her husband live in Baltimore, Maryland, with 2 dogs who frequently make appearances on her Zoom calls. Kate, I'll turn it over to you.
Thank you, Brittany, and thank you everyone for sticking along. I know for those people on the East Coast, I'm kind of standing in between you and dinner. So I'm here and it's been a complete honor to be kind of one of the speakers here after this panel. So hopefully everyone can see my screen. I think I have a little bit of a different presentation. And so I'm here to kind of share these new, the platform enhancements and just the continuous iteration that we've been making to the platform. And I know that we may not have time for questions afterwards, but please, you know, we are designing this to make this platform and these resources accessible to you and your communities. So please, you know, if you have comments, drop them in the chat. I know my team is on as well, so they'll be monitoring as well. And so what I have up here, as you can see, I actually have my phone that's plugged into my computer, as well as having the platform up itself, the desktop browser. So the platform itself, and you can see I'm not one of those people who is anti-notification. I'm not. I should probably clean out my inbox, but the platform itself is available on the Android and the iOS store. So just so you can see here as I tap it, it's so it is something that, you know, if you don't like, for however you want to access it, it is kind of there for that, the vehicle that you need, mobile, desktop, tablet. As you can see, it's the resources and the support functionality is all the same. But what I'm going to do is actually, I'm just going to close this out. So I won't be going one by one. I'm going to demo or show off kind of these new elements and enhancements on browser just to make it easier. And so you'll see one of the things that we do, my team, we do focus on user experience kind of design and understanding, you know, how we can make this as accessible as possible. So, you know, if you come back, we pretty much put out monthly releases. So you know, if you come back month to month, you'll see probably some changes. And again, we appreciate all feedback, right? We love to, I think what we focus on and what we try to do most is co-create. So if you've been here before, there are some elements that are definitely new. So a couple of the things that we wanted to point out were, first off, this ability to translate the site itself into different languages. So we have Spanish, Samoan, Haitian Creole, just and what I wanted to point out here is that when I do translate this, as you can see, it's going to reload. And now the entire site is translated into Spanish. This is, some of the elements will not be just as kind of, it's not part of the source code. But you can see that this is happening through an automatic translation. So there might be something that isn't always kind of one for one to the native speaker, but it is meant to kind of make all of these resources and the ability to navigate more accessible for you and your communities. And then to that point, we've taken a pen, or we've kind of looked at some of these other elements. So on the language, to kind of the language and the different resources. So when I'm on the educational resources here, we are continuing to add filters. So if I'm looking for information about, in this case, COVID-19, I can filter that. If I search, now I see some of these. And then we also have the ability, so right now, again, you know, the components here, right, are the working to make all of these resources as accessible and, you know, expanding that reach and making content available. So the difference there is the ability to search on, in this case, content and resources that have been written natively. So this is, these are pieces where it's not, you know, it hasn't been translated by a computer, but someone has actually sat down and written it in the native language. So that's the difference. As you see here, there is kind of this language bar up here for the whole site. And then there's these components, or the ability to find source language resources. The next element that I want to highlight is there is this news tab. So here is the ability to just see, you know, curated, the latest curated COVID-related news as kind of pulled together by the INSERN team. And then as I jump, oh my gosh, my computer, it's killing me. I think another thing, as we were doing a bit of an assessment of this, is the ability to sign up and join the network. So there are a couple different places that you are able to join up or join, and that's either here in the join the network on the main site or the main page, or if I go to about NSERN, I can go to join. And we've taken a hard, kind of a hard look at the sign up flow before and the sign up flow now. And that is, yeah, I think we really wanted to help the users understand kind of, should I sign up as a community organization or should I sign up as a community member? Because I think, you know, for those of us who have been working with this, it makes sense to us. But it may not be so much so for kind of someone who's coming to this relatively new. So we have these different, you know, how, or, you know, if I'm, you know, an academic institution, or if I'm just someone who would like some news alerts, how would I kind of go about signing up? And we've also simplified that sign up form in itself. So you won't have to watch me fill out the whole form, don't worry. But you can see that there are these different pieces or the different stages. So I can see where I am in the process. It's very pretty clearly laid out, and hopefully kind of reducing some of the complexity and the barriers to getting folks to sign up before. And obviously, of course, that ability to, if you're having issues, contact us. The couple other pieces that we just wanted to highlight, the last, or the next to last, sorry, not to get your hopes up, is this support finder. So this is helping the users. You can come here and find what those kind of public health resources are in your community. You can search on behalf of someone else. And if you're familiar with this, so I am based out of Baltimore, as Brittany noted. If I'm looking for testing locations, this is then I'll be able to find that, and you'll see kind of those pop up. So for me, the nearest is at the Baltimore Convention Center. There's a whole set of different services that are available. The vaccination centers, pharmacies, mental health, and we will be in the coming months adding broader than kind of COVID resources, but more public health resources. So things like food pantries, transportation, and really different, really expanding kind of the services and the search functionality. So we are very excited to be able to share that out. So the last element that I wanted to call out here is we've tried to clarify just some of the ways to navigate the portal and the site. So if you, as you can see on the bottom, we have this new footer with the ways that you can, if someone wants to get in contact with the NCERN team, right? We have this ability, if I wanted to, I can call, there's email, there's the form. And then going back again, we've updated the kind of about NCERN and the contact tab here. So what you'll see is if you do want to get in touch, and this is something, again, kind of closing the loop, that the support center, there are representatives who are available to speak in the caller's preferred language, right? So again, being able to converse in that native language. But there's also by email. And again, if I wanted to submit a form request, I can do that here. And the very last thing is that we've introduced or tried to kind of put a process around the speaker request. So for community leaders and organization leaders who want to hold events and have a speaker that's kind of coming through the NCERN, instead of sending an email, we have this new speaker request form so that we can make sure that your request comes through and that it's being tracked. And so, especially as you're planning events, this is available to you as well. And as I said, we are continuously making updates and iterating. So we love all feedback. Please, if you see this and you think about it and you want to send a note, I'm sure there's a way to get that back to me. And as always, kind of check back every month and see the updates that we're making. So that's it for me. Thanks, everyone.
Right. Thank you so much, Kate. That was excellent. And we know that your team has been working very hard to make sure that we're making those great content has been updated and to really feature and make sure that the information that's needed is easily available and accessible. So everyone, please continue to look out for the enhancements that are done, and also just realize and recognize that we really want the NCERN website to be your go-to place, and that we're going to continue to work on improving the site and making it much more, it's already been more user-friendly, but just making it a place where it's a trusted and credible place and source for information. With that, we are actually coming to the end of the road. And so I just want to make sure that you all have the opportunity to know that we have an evaluation form. We really would love to hear your feedback on how you felt the experience was for this exchange, for the community exchange. We really are just excited to plan future events like this and make sure that we are really addressing and meeting some of the needs that you all have, and that we are able to feature and really highlight the great work of our partners that they're continuing to do to mitigate the impact of COVID-19. So make sure that you, I think that link is also going to be available in the chat, and we would love to hear your feedback. And with that, I'm going to have Dr. Akintobi close us out, make any closing remarks, and even any calls to action from what we've been able to hear and really hear from our partners. You guys are definitely inspirational speakers, and we are really just honored to be able to hear all the work that you're doing. And thank you for impacting the lives that you have in your communities. And it's just an incredible privilege to continue to partner with you as we work towards the NSERN mission.
Thank you so much, Christine, and thanks for everyone for staying the course, as Christine described, this journey of learning, sharing, as well as garnering resources as we continue to navigate this path towards COVID recovery. So we started our time hearing from Victor, who really helped to shed light on important and unique challenges and realities in the communities that he serves, including tribal communities, and his leadership in really supporting the path forward. And a bit of what he talked about included the importance of addressing some of those fundamental basic needs like housing and food, all of those things that were issues before the pandemic that we must not forget about, that people are thinking more immediately than necessarily getting a vaccination. So all the things we must address that are our priorities for communities. We heard from Dr. Holden that there's no health without mental and behavioral health. She talked about all of the issues that, again, have been magnified during this time. And then Lane really set the stage on addressing two important things for us. First, that we must attend to our mental and behavioral health before we can address those that are the precious next generation, the issues of children, how they're navigating loss in this pandemic, and the ways that we can do it with a spin towards interactive activities, resources, and interventions that attend both to the things that are heavy related to this pandemic, but are important in terms of the path forward. And then finally, Kate talked about important resources that NSERN has for you as you consider your own path forward, both personally and as professionals and organizations that are boots on the ground in being resources for the community. So I just want to thank everyone again for their time. And I would just say, let's continue to attend to and listen to the science, but recognize the challenges that communities face as they listen to the science and attend to their immediate needs. Together, we are the path towards recovery, and really consider NSERN as your resource in doing that. Thank you so much. And let's continue to exchange as community leaders in COVID resilience. Take care and stay safe, everyone.
All right.
Good night.
Thank you. Good night.